Okay, ladies, let's get into it. But first, let's agree on some terms. Stacey, as the top Democrat in the Georgia Assembly, you at the time worked on bipartisan efforts to save universal pre-K from some budget cuts. So could you talk about how politicians see this topic? Is it a local issue? Is it a national issue? Is it a back burner issue?
I think, unfortunately, first, Chastity, thank you so much. And Dr. Iheoma, thank you for a kind introduction. I think we have to remember that for most politicians, they deal with the people who can vote them out of office. And that tends not to be 0 to 3. And so, unfortunately, while it is a constant conversation, it rarely gets the prioritization it requires. But it's also the most short-sighted set of decisions we can make if we do not give it primacy. If we educate children 0 to 3, prepare them for pre-K and prepare them for kindergarten, we are actually preparing our societies for stronger education, for lower rates of incarceration, for higher rates of productivity, and for a sustainable opportunity for those families. What we see happen, though, is that it gets encompassed in this larger conversation of education, and then it gets shunted to the side because the presumption is parents should be in charge of early childhood education, ignoring that cycles of poverty, cycles of lack, cycles of undereducation have prevented the capacity of those parents to provide for their children what they need. But we also know that it's a significant part of our economic system, that we are watching families that have to go back to work, unfortunately, are being forced back to work too early. But when they go back, when they're essential workers, they have to have somewhere for those children to not only be taken care of, but to learn. And the one thing I'm going to point out is that we know that if we do not tackle this issue, 4.5 million children will live in childcare deserts by the end of this pandemic. And because of those razor thin margins, because of that low pay, because of the lack of attention being paid in the CARES package and the upcoming relief packages, unless we have specific investment in childcare and early learning, we are going to watch another generation of children fall behind.
So Iheoma, could you back us up just a little bit? What are we talking about when we say early childhood education? Is it pre-K? Is it, like Stacey was saying, 0 to 3? Like, is it all encompassing? Give us some terms here when we talk about early childhood education.
So absolutely. So first, I want to say that one of the reasons we selected Stacey for our keynotes is because of a fight to ensure that Georgia pre-K does not get cut, right? And so pre-K is one aspect of the early childhood education sort of facet. So pre-K is important, but there's many parts to it. Some people often think of early childhood or childcare as just babysitting, but the science is clear about the importance of early childhood education. There's a diversity of programs that range from school-based, center-based, home-based, and even some of our friend and family neighbor care, right, which are not always formalized. So there's a lot of different types that go beyond just Head Start or even early Head Start. So there's a lot of children who are out of home care. So it's important that we begin to ensure that children have the best early years, regardless of the setting, the type, the auspice, etc. So when I talk about it, I sort of see it as programs, services, any learning experiences that serve multiple purposes, which includes parents being able to go to work, providing high quality care, but more importantly, really setting children up for school and life. So really an early childhood is really a space for children who are being cared for and nurtured through a high quality, competent professional in a healthy, safe, and affirming environment.
So you both touched on the issues of COVID, right? Can we talk a little bit about that? Let's dig a little bit more deeply. We know the pandemic has closed child care centers, and that's a pause that a lot of operators might not be able to survive. And Stacey, you talked about the CARES Act. Let's just unpack that a little bit. What needs to be done on the state policy level, the national policy level, to ensure that we have adequate early childhood education, adequate, daycare post-COVID? Stacey, you want to take that?
Sure. And I think we have to start with the current pandemic and move into recovery.
Yes.
Because one of the challenges we have is we tend to skip over the immediacy of need, and that then allows us to ignore the long-term responsibility. And so if we start with the investment that needs to be made right now, the National Women's Center estimates that there should be about $50 billion put in place for the childcare space. And as Iheoma pointed out, that means in-home workers. Those are the folks who, we used to go to Miss Carter's house. That was our childcare. And she made sure that we read, that we learned. We need to make certain that those thin margins that those childcare providers are operating with are not going to lead to their decimation. And unfortunately, we know that those slots are going to disappear if they are not invested in during this process. A lot of those families, a lot of those providers aren't currently eligible for the Paycheck Protection Act. And so they're not getting the resources they need. We need to also make certain that those workers have access to health insurance. Those teachers, those pre-K teachers, those K through 12 teachers get the most attention, but we need to pay attention to the underpaid educators who are usually childcare workers and are pre-K teachers, that they have health insurance and they get subsidized payments. And to the point that you made, Chastity, we know a number of them are also on public benefits. They are taking advantage of our social safety net. Their income should not count against their safety net benefits. The second part is that we have to have federal responsibility, but local implementation. And that's, I think, the other challenge. There's this notion that if we cede it to the federal government, they will fix it for everyone, which isn't true. But they can set standards and they can provide the resources. But on the state and local levels, we need to make certain that we're meeting people at the point of their needs. We know that in rural communities, we already have childcare deserts, where Head Start is the single most effective program, but it's also the single largest provider of any childcare oversight for 0 to 5. So we need to make certain that those investments are made and that those frontline workers who traditionally are still at work, that they are given the personal protective equipment that they need, and that they are being given the supports they need. Long term, we need to plus up salaries. There should not be low wage workers taking care of our most precious people. They should not be having to struggle to reach their own basic necessities while they take care of our children, while they educate the next generation. And so they should be plussed up in terms of making sure that their wages are not just minimum wage, but living wage. They need to have access to health insurance, and they need access to housing, because often what creates childcare deserts is that those who can provide those services can't afford to live in the communities where the services are needed.
So I'm going to come back to that, because we're going to really talk some more about what people can do to make that kind of change happen. But Iheoma, you are in Michigan, you're in Metro Detroit, in the heat of the pandemic, in the heat of educational, early childhood issues as well. Is this a state issue, national issue? How do we address that in places that are having crises, whether it's being a desert, as Stacey was saying, a childhood desert, or just in crisis? Is this something that's a state issue or national issue from where you're standing?
Right. So obviously, HighScope is in Michigan, and it is an issue in Michigan and also an issue across the country. We know, as Stacey just pointed out, a study was just done by the National Association for Educators of Young Children and the Center for American Progress, showing that up to 50% of childcare providers may actually not be in existence. And exactly to Stacey's point, you cannot build a workforce where you don't have benefits and adequate pay, especially when making $11 an hour. During the time when we know that children's brain are growing at the fastest pace is during that prenatal through grade 3, and especially during that prenatal through age 3 space. But fortunately, I would say we at least have a great example from Governor Whitmer, who understands the importance of the childcare community. And on April 29th, she announced the Child Care Relief Fund of about $130 million to provide direct, non-competitive grants to childcare providers. And these funds ensure childcare providers currently serving in essential workers remain open, that childcare providers can stay afloat during the stay-at-home order, that childcare is actually more affordable for families as our economy begins to open. And childcare providers across the state, from rural to urban and in between, have the resources needed to reopen for Michigan's workforce. even with this investment, we already know, as Stacey just articulated, that we need probably $9.6 billion a month, right? And we know that the CARES Act won't cover that. And we need to really see the lack of childcare and early education as a public health emergency, right? Many children won't get the services and programs that they need to support their health and well-being. And we know this is likely to impact the poor and marginalized communities. We need to really provide adequate funding, support, and really pay our workforce, our essential workforce, as they have been deemed across the country during this pandemic, especially when we understand the importance of the first 3 years of life with brain development and so much more.
So one more time, what was the name of that that legislation that Governor Whitmer signed and that other governors might consider doing the same?
Absolutely. It is called the Child Care Relief Fund, and it was announced on April 29th.
Gotcha. Wonderful. So what do we do? What do we do beyond increasing awareness? What actions can parents and educators, community activists take to advocate for this kind of increase in funding so that we can have better quality early childhood education? Stacey, what can regular folk do?
Number one, they can complete the census. And I know that seems like a small thing, but the hardest to count communities are people of color, immigrants, rural communities, and children between the ages of 0 and 5. The reason this matters is that we use those numbers to predict investment in Head Start, in SNAP benefits, in our entire infrastructure. It's predicted based on the numbers today. And so we extrapolate as a nation from what we have today to what we need in 10 years. What that means is that if children are undercounted, the resources they need will never show up, but that also hamstrings the children to come. And we end up without enough slots, without enough investment, without sufficient subsidies. And unless we have governors like Governor Whitmer, we end up without the ability to actually immediately respond to crises. The second, so number one, fill out your census. Go to my2020census.gov, fill out your census, do it immediately. Because that number not only controls the economic investment, and I'm going to put one quick fine point on it, for communities of color, the expected undercount, so the number of people they don't think they're going to get to, will cost our communities $8.2 billion every year. That underinvestment compounds. So every year you don't get what you need is a year where you fall further and further behind, and this lasts for a decade. And we've got to understand this is what happened to us 10 years ago, which is why we're in the position we're in now. So fill out the census. That's number one, because it also allocates political power. This is an election year. And the best time to advocate for what we need is when people need our votes. The work that I'm doing, not only with Fair Count, which is my organization working on the census, but Fair Fight, which is working on voting rights, is about the fact that we have the ability to transform the policies that will guide us through recovery. But that only happens if we show up at the polls. And what's going to happen is in this election cycle, we're going to see a lot of different types of campaigning, but those who need to advocate, those parents who are facing losing their jobs because they can't afford to go to work and take care of their kids, they need to be asking the question of every person who wants their vote, what are you going to do to help me? You want to demand that there be subsidies, that the low pay that childcare workers receive be increased, but also that it becomes a national policy that childcare is an essential provision of services. Because when the economy reopens, when people go back to work, if we do not have the ability to protect our children, families are going to be forced to make terrible choices. So make sure you're registered to vote and make sure you hold your elected leaders accountable. And if they're not responsive, fire them. That's what an election is. It's about hiring and firing the leaders of our cities, our counties, our states, and our federal government. We have that power in 2020 in ways we will not see for another 4 years. And so use that power now because they're a captive audience and you deserve to be heard.
Let's vote. Iheoma, what do you say?
I can do better than that.
What do regular folks do? I know you hear from parents and teachers all the time in the educational community who are frustrated. What do you tell them? What do they need to do?
Well, I definitely tell them Stacey's line, you must vote and complete the census. But in addition to that, I would say that they have to lean in and engage in the conversation, whether you're even a parent or a non-parent, that whatever decisions we make about our young children, who are investments in the future, is going to impact your life as an adult, as an aging citizen, etc. And so it's actually leaning in and in that conversation and advocating in many ways, even for those of us who work multiple jobs, non-standard hours, being able to make phone calls, write letters, engage your neighbors. There's a lot that can be done when we actually collectively say, we are in this for our children. We also need it for us to work, right? It serves, again, childcare, early childhood serves multiple purposes. Childcare providers are businesses, so they are an important fabric of our community. Childcare is important for us to be able to work and do all the things that we want to do. And childcare and early childhood learning experiences are critically important for our children. So to me, we have to lean in. And I think ordinary folks, whoever you are, me included, that we can do more by just leaning in, engaging that conversation, learning more, pushing our leaders elected to continue to say, if you care for us and our children and our communities, you must invest in our most important prized possession. As a mother of two kids, I have a 6 and a 3-year-old. When I put them in childcare early childhood programs, they are my investments. And so I expect our country to invest in our children because we know it gives back multiple folds on so many levels.
Chastity,
So,
Chastity, can I add one more thing?
yeah.
And I just want to expand on what Iheoma said. I like to think of it in three things. One is speaking up. So often we struggle in silence. We don't tell our story because we're ashamed that we couldn't solve the problem ourselves. And because we struggle in silence, we don't realize that the person next door has the same exact problem. So our first responsibility is to speak up, share your story, not only with the elected officials, but with your neighbors so that you and with your colleagues, so that they understand that this doesn't just impact them or you, but it's a societal challenge. The second is show up. And in days when we actually got to go outside, I would say go to your Capitol, but in lieu thereof, call, text, email. It's exactly what Iheoma said. Actually, not only share your story with the people around you, but show up in the spaces where your elected officials are and make them understand your story. And the third thing is that we have to hold them accountable. So you speak up, you show up, and then you stand up. And that stand up is by saying, if I do not hear from you, your plan for solving this problem, then I'm going to use that as the reason I vote. And I'm going to tell all those people with whom I shared my story that they should use it as well. We cannot underestimate or we cannot overestimate how important that communal connection is, where people, if you say, this is why I'm going to vote for this person, or this is why I'm not going to vote, because when I told them about this crisis I faced, they turned a blind eye. That's how you get people to be more responsive. That's how you get legislators at every level of government, how you get executives to respond. It's by speaking up, showing up, and then standing up.
So just to put a finer point on that, who is supposed to care? When you lean in, when you go to vote, are we talking about policymakers who deal with budgets in the state legislature? Are we talking about the governor? Are we talking about the mayor? Are we talking, specifically, because there are people who are really ready to engage. And I just wanted to give them a little bit more about who exactly is supposed to care about this and who to reach out to.
Okay, so let's start at the baseline.
Yeah.
Your school board is responsible for the education of children. We tend to cordon that off and say pre-K to 12, but that's in our imagination. Their responsibility is the education of children. And we should hold our school boards accountable for solving these problems. And there are school districts around the country that have expanded to cover 0 to 3. And if you don't live in one of those communities, you should ask why not. Number 2, you have to think about your mayor, your county commission. They not only provide services, they also provide facilities. Sometimes the challenge is that people just don't have access to the place to provide those services. And because, as you both said, these are businesses that should get investment from the city and county government to provide the support and the resources necessary to serve the workforce. And so absolutely demand action from your city and county level. At the state level, the state budgets are always anchored by education budgets. And those education budgets have to begin with early childhood development. the extent to which they say, well, we don't really have responsibility except for oversight of childcare facilities, that's not true. They are responsible and the budget should reflect it. But don't just look at the budget, look at the tax incentives. There should be tax incentives for the provision of workforce-driven childcare support. And so make certain that this is being pushed into every part of the conversation. And then ultimately at the congressional and federal level, we want oversight, but we also want investment. And we know that we have already spent trillions of dollars responding to COVID-19 to just meet the moment. But when it comes to recovery, that's when the real work starts. That's when the real dollars are going to be set. Everyone talks about a new normal. The new normal should be we solve this problem for the first time. And our new normal should be that in 2021, whoever is in charge of our country should have the obligation to have a specific policy for how childcare and early childhood development becomes a national initiative and a national priority.
So, Iheoma, HighScope is just full of all kinds of data and research about this topic. Can you talk about what is at stake? Specifically, what happens if we do nothing? What are the data points around the importance of early childhood education that will help people to understand why this needs to be a national issue? What's at stake if we don't do anything?
So I want to sort of highlight that in many places, from conservative to liberal, we do, I think, see that early childhood is viewed as a bipartisan issue. Now, how funding is dispersed and given out, that's where the rubber meets the road, right? So some people just think pre-K. And I think to Stacey's point, we have to really think of it as a life course that it starts prenatally, right? And then into birth and through that, right? So we have to think much more in this long-term sense of it. I don't think we have an option to not care, right? So the do nothing, I don't see as an option because we have articulated and we have found from the pandemic that childcare is essential. So even if we disregard the science that shows the importance of the early years, essentially we need childcare and we need early childhood to function at the highest level because we need our workforce to go to work. So even just based on that simple premise of just needing people to go to work, we need our childcare to function. But we also need it because we know that the investment in the early years is like it's like anything. When you invest early, the returns are pretty amazing. And as Stacey said early on in the broadcast, we know from evidence from the Perry Preschool study that children who receive this high quality early intervention in a healthy, safe environment where they would engage in interactions, connections, and collaboration and partnership with families and communities, that had long-term impact in terms of whether it's criminal activity, whether it's education, use of public services, and even health, right? In terms of lower health, negative health outcomes. So we know the impact is really just beyond the 3, 4, 5 years old. So similar to health, we should really begin to see early childhood education really as a right. We provide vaccines to inoculate. It doesn't say that you should never, go out and run and be healthy, but it's to inoculate you a little bit, right, from all potential diseases. Again, early childhood is not a panacea. It's not a bullet, right? It's not a one-size-fits bullet. However, it's an inoculation to begin to ensure that children, right, during, again, the most important critical years of their brain development, of their self-regulation, and all these really important things from language, communication, because it is the beginning formation of those important neurons and systems building, we have to get it right. Because if we don't do anything, we could probably understand what the ramifications could be for our economy, our communities, and most importantly, for our families. And we owe it to the children, we owe it to the community, we owe it to our families, right? So early childhood started on the notion that children who are in poverty, marginalized communities, children need to be set up for school and for life success. And so we owe it to children that we actually invest. So doing nothing is actually not an option that at least I can see happening.
Yeah, absolutely. Again, I point people to that study that Iheoma mentioned, the Perry School. It's 30-year long, was it 30 or 40
50
years?
is 50 plus 50 years. Yes,
It's 50
over 50
this year.
That's right.
It's a 50-year
right.
longitudinal study that shows the differences in life outcomes for children who have quality early childhood education and childcare and those who don't. The differences are vast, and it's a 50-year study. It's the Perry preschool study. I
That's right.
challenge everyone to go take a look at it. We're going to take some questions soon, but first I want Iheoma and Stacey, if you could talk about the larger role you see early childhood education playing in strengthening our economy, because there are people, there are voters who don't have children in their families, who don't have children at all, and it's not on the front of their mind to think about early childhood education, but the economy is on everybody's mind. So could you talk a little bit about how early childhood education, the role that it plays in strengthening our economy, especially post-COVID? Stacey?
Well, I would begin by saying, even if you don't have a child, if you have to pick up an extra shift because someone has to miss work to go take care of their child, that child's affecting you. If you are paying more in taxes because we've had to increase the social safety net, if we are paying more in taxes because we have to deal with the social pathologies that come along with undereducation, then that child has affected your life. But the flip side is that the extent to which we actually invest in early childhood education, we see better returns on investment in our entire communities. We see better trained workers. We have people who are better equipped to deliver services and to create new jobs. We have to remember that our economy depends on every generation's contribution. And when we underinvest in any generation, we are underinvesting in the future of that economy. And as people begin to age and begin to retire, you want an educated workforce that can take care of you, that can invest in you, and that can make certain that the economy continues to support your retirement. And so I think we have to not only think about the longitudinal study that is the Perry study, we have to think about the longitudinal connection that is our economy. We are always depending on the generation before and the generation after to determine our success in the moment. And if we underinvest by ignoring the importance of early childhood education, of the provision not only of education, but of promise, then we are underinvesting in who we are. And when we talk about recovery, we cannot let ourselves recover back to what we had before. Recovery should mean that you've learned and do better. And what we should learn is that we must do better by our childcare workers, our early childhood education providers, because they are a backbone of our economy. They allow parents to work and they allow work to be done, which means they allow our economy to function.
Iheoma?
I mean, I would just add I'll just add a couple of things. One is that we need the childcare in order to actually be able to work. Um, and obviously, like we said already, childcare is also a business. So if we really value businesses, we should also think about the childcare providers who are operating as businesses. And we know from the HighScope preschool study, and similar to the Carolina Abbotsford study, we know that every dollar invested, you get a 7 to 10% return, which is higher than the stock market. So this is an investment. And so we can't just think short term.
Say that
We have,
again. I need you to say that
I
again.
I will say it again. Every dollar invested, you get 7 to 10% return, which is higher than the stock market. Again, this comes from Professor Heckman at the University of Chicago. That's what we found, that just this investment in early childhood has long term. So not just short term. So we can think about till end of 2020, but this is about the life of children, but also the life of our country. 7 to 10% return on investments. And we also know that early child experiences is predictive of children's later outcomes in education and in health, and really most important, becoming a contributing member of society, whether it's voting, whether it's working, whether it's being a policymaker. We understand the value of it today because it means that our country will be better tomorrow, especially for our most marginalized communities, our children of color, children in low wealth and low resource areas. This is their lifeline in many ways.